What are the causes of teenage pregnancy? Why is teenage pregnancy prevention important? And how does teen pregnancy affect the teenager mentally? Hello and welcome. I'm your host, Dr. Mosam Tomen, and signing with us today is Pearl Mbolegwa. On Vital Signs, we'll focus on teenage pregnancies. Coming up in the program, we'll listen to an insert about teenage pregnancies that are on the rise in the Free State Province, according to the Health Department statistics. We'll listen to an insert about the challenges faced by pregnant teenagers in rural areas in the Northwest Province, and we'll speak to Deputy Director for Women, Sexual and Reproductive Health from the National Department of Health about primary preventions that can help prevent teenage pregnancy and secondary interventions such as contraceptives, safe pregnancies, and as well as terminations. Now, and lastly, we'll speak to obstetrician and gynecologist about the health risks of teenage pregnancy. Remember that you can be part of the show by asking the guests that we'll have on any question that you have on your mind. Simply share your view on what we're discussing today. The number to call is 011-714-0677 or 011-714-0678. You can also share your thoughts with us on social media, on Twitter at SABC Vital Signs and on Facebook SABC Vital Signs. The show will continue after this ad break. Stay with us. Welcome back to Vital Signs. A total of 150 young girls aged between the ages of 10 and 14 have given birth in the Free State in the past 5 months. Now, statistics from the Provincial Health Department show that just over 14,000 teenagers aged between 15 and 19 gave birth in the past year. 2,100 pregnancy terminations were recorded amongst those ages between 10 and 19. Here is a package for you to watch.
An alarming 150 childbirths in just 4 months for girls aged between 10 and 14. Yet, the Free State Health Department says it has recorded a reduction in teenage pregnancy. The South African Medical Research Council reports that even before the pandemic, 16% of young women aged 15 to 19 had begun childbearing. The figure ranges between 11% in urban areas and 19% in rural areas. In the Free State, the Thabo Mofutsanyana district recorded the highest number of cases of teenage pregnancy. The United Nations Educational, Scientific and Cultural Organization says challenges with accessing sexual and reproductive health care services for this vulnerable age group is a cause for concern. However, 2 pregnant Bloemfontein schoolgirls have different views about their pregnancies.
My pregnancy is not excellent. I want it because I want to support a child that will call me a mom.
I wasn't planning to have any child at my age, the grade that I'm in, but then it just happened. Like, it was just unexpected. I wasn't ready for it. Just came out, boom. Then I was pregnant. I couldn't believe it, but I just had to accept the fact that I am pregnant. Yes. And I felt like I disappointed my parents so bad.
The health department says its youth-friendly zones in its clinics caters for sex education for young people and encourage family planning to avoid unwanted pregnancies.
We've got a high rate of children that are having children 10 years up until 12 years, and then from 13 years we see also up until 16 years children who've got the youth in that teenage pregnancy.
To young men and men in general to say, what role can you play to protect our girls from falling pregnant, which is don't rape our girls. If you are engaging in relationship with our girls, make sure that you allow them to protect themselves.
The education department in the province has admitted that rape and abuse are often contributing factors to the high levels of teenage pregnancy.
You'll agree with me, issues of social economic statuses, they render learners vulnerable to pregnancies, where learners are being abused, learners are being raped. So with the number that we see, definitely there is statutory rapes where learners don't consent to, the sexual engagements.
A reproductive health care expert and midwife says the risk associated with pregnancy is elevated in cases of teenage pregnancy.
So in pregnancy, what happens is that the woman's body needs to actually cater for the needs of the growing fetus. So what happens in the case of a teenage pregnancy is the fact that the nutrients or, all the things that were supposed to be taken or rather used for the development of this specific teenager now have to be diverted to, the development of the growing fetus.
South African Medical Research Council reports that violence against women and girls contributes to the problem. In South Africa, 1 in 3 women experiences gender-based violence and 1 in 5 children under the age of 18 experiences sexual abuse. Kamogelo Siekwi, SABC News, Bloemfontein.
After the break, we'll listen to an insert about the challenges faced by pregnant teenagers in the rural Northwest. And then we'll speak to Tembi Zulu, who is the Acting Director of Women, Sexual and Reproductive Health from the National Department of Health, about primary interventions that can help prevent teenage pregnancy. Stay with us. Welcome back to Vital Signs. Now, pregnant teenagers in rural areas and informal settlements in the Northwest are faced by a range of challenges that prevent them from consistently attending antenatal care clinics. Now, these challenges include socio-economic issues, a lack of access to information, and of course, the alleged ill treatment at healthcare facilities. And some of these teenagers do not know how to protect their unborn babies from contracting HIV. Let's listen to this report.
According to the nurse, it is not surprising that women in rural areas do not access such crucial information.
We find out sometimes that the information have a agree, they don't get the information, but it is important that on the first bookings of antenatal care, that each and every patient needs to get a thorough treatment based on health education of antenatal care, and we do blood investigation also, and also monitoring the child, and also treatment needs to be given to them.
And it seems that lack of information is not the only challenge for these women, but they are also faced with socio-economic issues. This mother says she cannot afford transport to take her 13-year-old pregnant daughter to an antenatal clinic as regularly as expected. They say another big problem that makes it difficult for them to go to the clinic is the alleged ill treatment they receive from healthcare professionals.
Ne ke kopa dinese di re tshware sentle ka go ha re tsena ko tleliniki ha re tlodisitse ba re kgadi e petsa ha re ba bolella mathata rona gore a rena madi a go palama ba re le gore borra go bana ba rona ba kae a ile gore a ne re ithobala la re sa tlhaloganye sentle go tle bogote ra apole re kana mo di mogabe tha ke botsa gore a ke apole gotlhe re tle ba sa gagebe sentle
ngwana ga tsena ko tleliniking ko bophelong ga ba mo tshware sentle ba mmitsa under age ba mo go itlhelele gore anong maikutlo a gagwe ile ko godimo wa lla tsena ko tleliniki.
Healthcare professionals say such treatment should be reported.
It is important that immediately if you are not happy with the service that has been rendered to you, you need to complain to the facility manager or sister in charge on the specific day, or there's a suggestion box where you can write your complaint and put it in the box.
For adolescents who are sexually active, using effective contraceptive methods can, of course, help reduce the chances of unwanted pregnancies. Now, the reality is teenage girls are often offered fewer contraceptive options and a more limited explanations are given to them. And, of course, the information that is given to them at public health facilities is decreased compared to older women. As a result, there is a low and inconsistent uptake of contraceptives amongst adolescent girls and young women, which in turn leads to unintended pregnancies. Now, to speak to us about the primary interventions that can help prevent teenage pregnancy, we're joined by Thembi Zulu, the Acting Director for Women, Sexual and Reproductive Health from the National Department of Health. Thank you so much for joining us today.
Thank you very much, and thank you for having me.
So let's talk about the causes, and I think it's an important thing to start off with, where whenever we speak about teenage pregnancy, there's always that big thing of who is causing these young girls to be pregnant. So in terms of causes, where do we find ourselves looking at the possible causes of teenage pregnancy?
We don't have a specific cause, you know, that actually caused the teenage pregnancy, because we believe that everybody have a role to play in terms of teen pregnancy. It starts from home, it starts from the society. The society has a role to play, and then also families have a role to play before the teen pregnancy, before the department, or as department we can talk about the teenage pregnancy. Everybody have the role to play. That is why I'm saying, for us to prevent the teen pregnancy, there is a need for us to work together, starting from society and then families, and then also now involving the government. It is important that we need to work together.
So what do those different remedies or solutions to the causes that we will identify, what do they look like? So from a society perspective, what should we be doing?
I normally say it is important that we need to go back to the roots. Where, like, my child to be my child to be your child as well. And then you must see my child as a girlfriend, or as a potential girlfriend. So if you come across with my child, you must also protect my child, a girl child for that matter. You protect the girl child, you must see the girl child as a potential girlfriend. It is important that all of us in all level, we need to give information first before we can actually talk about the contraceptives. But from the societal part, from the family, we need to also give information how the girl need to behave in a society, in the family. Also in the family, we need to be there for our girl children. We need to be there for them. And then we must not like a robot, where like the robot or the sign language will tell you how to go to Durban, but that sign language, they don't know the Durban. But what I'm trying to say, whatever that we do in the family, and then we must be a role model in our family, so that the girl child can see how things are supposed to be done in the family, in the society, before we can talk about a different method of contraception. It starts there in the society and the family for us to prevent this pregnancy.
Now, I mean, so let's look at this example that you've given, this idea that we as society or us as families need to start amassing ourselves around young women to protect them, amassing ourselves as young women to teach them different things, so issues of sexual education and things such as that. But this leaves out an important player, this idea of the boy child that, you know, most of the time plays a role in getting the young woman pregnant or the young girl pregnant. So, I mean, a lot of the cases are, of course, peers, for instance, where a 15-year-old is sleeping with a 15-year-old and they get pregnant, and that's one way. But of course, there are other avenues in which this happens, where older men take advantage of young girls and then they get them pregnant as well, and then there's that statutory rape that comes into play. So what are we doing for young boys to ensure that we're not leaving them out of this big loop that they're actually a part of?
In sexual and reproductive health, we are saying it takes two to tango. We are now starting to involve boys, because we realize that boys have been left behind, because we were trying to capacitate or give information girls, but the boys were left behind. But now we have started to take boys along to provide the information, because like if both of them, girls and boys, they have information, so we'll win out this teen pregnancy that we're facing in the country. As well, the fathers, they must play the big role. They must not see these young girls as the potential girlfriend. They must see the girls as their own children, so that they also they have a role to play to give them information about especially sexual education. Yes.
Now, sexual education is one that comes with a bit of resistance in terms of our society. So, in as much as us as a community may sit together and say, you know, we want to protect the boy child, we want to protect the girl child, we need to educate them, it looks a little bit different when we then say it's time to start teaching these children, where you say we're going to use the Department of Basic Education and teach these children in school. We've seen that come with a lot of resistance from parents saying, you will not teach my child about condom use, about prevention, about sexual education in a school setting. How do you navigate that space where you've got children who are falling pregnant, the numbers are on the rise, and you want to teach them about sexual education, but you've got society who are the parents that will be resistant towards an explicit type of education for the children?
Education to the society and the parent as well. It's normal, like if you've got a child, a girl child or boy child, always you see that boy child or girl child is small, you know, so we never grow. Like even you see how old I am, but if I'm with my parents, they see as my child. So it is important as well that we need to capacitate societies and parents to empower them on how to engage their own children and talk about this sexuality. Because if you are talking about children about sexuality, it's not to say we are teaching them how to have sex. We are teaching them, you know, the part of menstruation, when it's supposed to be, where as they menstruate, how are they supposed to handle themselves, you know. You teach them their body, you know, physiologically, anatomy, you know, they understand all those issues. So what is important that also parents and society, they need to be educated so that they are able to engage their own children, you know, because if they don't have information from their home, going back to the street, they will have wrong information from their peers. So that is why at the end of the day, because there is no basic information from home, so they grab information from the street and they utilize that wrong information. That is why now we are faced with this teenage pregnancy in the country.
All right, we've got Livia from KZN on the line. Livia, how are you?
Hello.
Hi, Livia.
Njani baba?
Ngiyaphila njani?
Ngibhekile la iphone ngiphela uyangibona. Nginomzukulu la, umzukulu wami usithi he has been started to sleep with the men nabantu abadala nakuye ana 14, so esikolweni udropile. So last year umama ke uthe last month umama wakhe uyomdrop uyomlekise clinic nekwatema clinic ngila eGauteng extension 3 extension 2 temp. So umntana lona uvela wathuka umama wakhe wamkhuluma nje into ezinak, so ama-nurse azange akhona ukuthi amvime. Bengisekwathema iKwaZulu Natal.
Oh, sekwathema. Okay, ngiyaxolisa. Yebo.
Yeah, so bengicela usizo, angazi ngayenza kanjani ukuthi umntana lona angangafodi pregnant ngoba manje endlini umama mnaye sengamdubile noma makumdubile, so ngiyafuna ukuthi ngimthathe ngibisele esikolweni. So umntana lona uhlale kwathema hostel, so the way ngidepressed ngakhona lo mntana una 16 this year uqabulela na 13. So bengicela usizo, angazi ngenza kanjani.
Ukalo kwenzana na 13 angizwanga kahle?
Ukulala nabo bana amadoda.
Sure. Okay. Siyabonga ne, sizama uku-answer umbuzo wakho, okay?
Okay.
All right. So a situation that isn't a new thing that we've heard, where you've got families and, of course, those socioeconomic issues that come about that leave young women vulnerable. So in this situation, at 14 to now 16 years old, she stays in an environment that isn't necessarily conducive for a young woman to be in and is sexually active, but does not want to be on a contraceptive method of some sort. How do we handle situations like this?
What I can advise in that situation, what is important is that the child can go to the public health facilities, and then the child can be cancelled, you know. Why, as the child is being cancelled, so the clinician, the nurse or the doctor will find a way of end up the child being accepting the contraceptives, but without coercing the child.
Yeah.
Yes.
So in that situation, I think we're at a bit of a crossroads here, right? So you've got a 16-year-old. So at this point, she's got autonomy with the sense that she can make her own health decisions, and she chooses not to be on a contraceptive. But as the family, you understand that should this girl fall pregnant, you will at some point have to take care of this child. You're going to have to be a grandparent and look after this child and things such as that. So where does that balance come in, where you've got a teenager who's got the potential to fall pregnant, but they've got their own autonomy and can make their own decisions about their own health, and you can't necessarily force them to be on a contraceptive?
Yes. What is key? You cancel both. You cancel the child, you cancel the mother, because it doesn't mean that if maybe the child doesn't sleep at home, maybe she's sexually active, but during the counseling, one will identify and find out whether the child is sexually active or not. And then because we'll talk to the child as an individual and through counseling, the child will speak out to say that, it means irrespective that I don't sleep at home. Maybe I'm just going there to the party, jiving, but I'm not starting having sex with anybody. And then maybe the parents are panicking because the child is not sleeping at home. They think that the child is starting having sex. So both parties, it is important that the nurse and the doctor need to sit down and counsel them effectively and find a way, And then if maybe the child has started having sex, is then that again will do a specific counseling around that, and so that we give an advantage to the child to say that if we use contraceptives, that the pregnancy will be prevented.
Well, look, there are a number of things that go here, and I think Dobalega Kulu, when I live here, I say what tema is Ugutin Hambe, one of my social worker in and around the area. So, man, I told you tuba, Nyambe, near clinic in Buza, my social worker, and I told Agupi, Ugutun, Konuklala, as Umtuana, Nana Bazal, no, my family, Utini discuss a lenda, but Nibo, Gutigatlak, and Atlanga Gupi, no Gutigui, Wanjani, Pambid. Well, we continue our discussion, of course, with Thembi Zulu, the acting director of Women's Sexual and Reproductive Health from the National Department of Health, about secondary interventions such as contraceptives, safe pregnancies, and of course abortion. Stay with us. Signs, a national study by Barron et al., published in the South African Medical Journal in 2022, showed that the rate of pregnancies amongst girls aged between 10 and 14 had increased by 48.7% from 2017 to the 2021 period. Now, a key factor contributing to the sexual and reproductive health risks that adolescents face in South Africa is a lack of access to comprehensive sexual education, as well as access to affordable and appropriate health services. Now, to speak to us about secondary interventions, contraceptives, safe pregnancy and abortion, we continue our discussion with Thembi Zulu, the acting director for Women's Sexual as well as Reproductive Health from the National Department of Health. Now, can you give us a roundup on the ground of how bad the situation is? Now, I've said 47 or 48.7%. It's a staggeringly shocking number to hear. But is that the reality on the ground?
Yeah, it's a reality on the ground. We cannot deny that in the country we are faced with teen pregnancy. So as the department, we are trying our best to correct the situation. And current what we've done, we have developed the guidelines that are actually guiding the implementers how to implement sexual and reproductive health and right at the facility site.
What does that look like?
The guideline.
Yes. So what is the, so for Musa, who is a 16-year-old girl and doesn't have information, what do those guidelines mean to me? What will I have access to?
So the guideline actually are meant for the clinicians, the implementers, as I'm saying, on how to implement the very same services to the end users. The end users are young people. And what we've done as well, we develop the training curriculum, and then so that the services must be standardized. So whoever staying in Gauteng or staying in Western Cape, staying in KZN, the young person must receive the same service. So again, as the department, what we've done, we've changed how we've been doing things. So we are engaging the very same young people, targeting higher learning institutions, and in all the provinces, and engaging them, and then trying to get the information from them. Why are they not using our services? Why are they not using contraceptives? Because we are kind of tired to assume, you know, maybe sitting in our boardroom, assuming that maybe this can be the issue, can be the issue. So what we've done, we're moving around and then engaging young people, doing a youth dialogue, and then trying to get from them what will be the issue. Why are they not using contraception? Why are they not find themselves being pregnant? Whereas we are saying, as the department, we do have services that can prevent unplanned, unwanted pregnancy. And so far, the things that they've cited the issue of our services not that much accessible to them, are not accessible to them. So as a department, again, went to the drawing board to say, what is it that may make that gap, to close that gap? We have now conducting training our clinicians, nurses and doctors, so that in all the facilities they must provide effective, comprehensive sexual and reproductive health and services, so that as and when, if young people come to the facility, they access, irrespective which method that they want at that moment. And then we are saying, if they come to the facility, they choose a method, because what is important, what we emphasize, that if they come to the facility and then let them, the clinician, talk about all the method that is available, and then the young person or the woman must choose the method that is relevant, to them, that it must be their choice. So once they choose, then that method will be given to a young person, because we want to sustain the services. We want the young person to come over and over, because once for example, if they give the method that will last for 3 years, after 3 years, they must come back if again they feel that they're still not ready to fall pregnant.
Okay, we've got Ashley on the line with a comment. Good day, Ashley.
Good day, how are you, sir?
Very well, sir.
I'm fine, thank you.
What's your comment or question, sir?
I'm saying I personally develop programs that help to enhance the character and the behavior of boys and men in particular. So I would love to offer those programs as part of solutions to the challenge.
What does it look like? So if you could briefly tell us what a program that you run, for instance, for boys looks like. What kind of things are you teaching?
Here we're looking at enhancing the character and the behavior of boys and men in light of the present situation in the South African context. Because we're trying to prepare them in a specific way to shape their outlook towards girls and women in particular. Also to help instill a relationship of trust and friendship, and also cooperation between the genders without one looking up to another or down upon another.
Well, very interesting, Ashley. Thank you so much for that. I think if you hold on the line, our team will get back to you and we'll definitely keep those details and, of course, disseminate that information so that, you know, we're not just focusing on the young girl, but also focusing on the young boy and how to stop this teenage pregnancy from happening. Because it doesn't affect one person, it affects two people, the people that made this baby. As Ms. Zulu would say, it takes two to tango. Thank you so much for your call, Ashley. Let's look at this idea of youth-friendly services. I know the government works very hard to try make as many of their facilities as youth-friendly as they possibly can. But for a 12-year-old, for instance, who would like to start taking contraceptives, are facilities friendly enough for them to walk in, not have to come with a made-up story of I've got the flu or I've got a cough, and still be without a guardian and a parent and be able to get contraceptives?
Yes, we are getting there. That is why in my statement I said we have developed a training curriculum.
Okay.
We are training nurses and doctors so that as and when if young people come to our facilities and then they come and have, you know, a friendly environment, and then without being charged, you know, because we realize that without training, sometimes it's automatically that if you are working in the facility, it just come on its own. If you are working in a facility, you are old. You look at this young person coming to the facility. You associate the young person as your own child. So now you end up treating this young person a client, because once he come to you at the facility is a client, is not a child. So automatically you see your child and then you treat this young person as your own child. And then so we are training them to actual fact go away from that. As and when if a young person come to the facility, he must treat that person as a client, because once he step in the facility, whether is your child, whether is a friend to your child, once he step into your facility, he's a client. He need to be treated as a client. Whatever he need as he come to the facility, you need to offer it.
Yes.
Offer them without being judging him.
I think let's wrap up our discussion around this idea of termination. So in as much as we've got teenage pregnancies on the rise, the number of young teenage girls that are having to drop out of school because of all these issues of being pregnant, being impregnated by their age mates, but even sometimes older people, the idea of termination is also a way that we look at in order to assist people that do fall pregnant. What is the current guidelines with respect to termination in South Africa?
Firstly, the termination in South Africa is legal.
Okay.
So that one we need to understand is legal. As and when if a person want to terminate, a woman want to terminate the pregnancy, he need to come straight to our public facility and request for termination of pregnancy. However, as much as I'm saying it's legally, and also it is supposed to be provided in a designated facility, the facility must know that that facility provided the termination of pregnancy. Over and above that, the termination of pregnancy is supposed to be provided by a person who is being trained to do that. You know, even if you can be a professional nurse, you can be a nurse, but you need to go to a particular training so that you qualify provide the termination of pregnancy. And then if you provide the termination of pregnancy out of that prescribed, it means that we are providing it illegally.
Okay.
Yes. Yeah. So in terms of who's supposed to come, any woman who's pregnant who felt that he can't continue with the pregnancy and then she wanted to terminate the pregnancy, she's allowed to come and be allowed to terminate the pregnancy. However, we don't like, if the woman come to the facility, we are not saying that the woman can just come and then we terminate. We sit down with the women, young person, and counsel first, because the key things is the counseling. We counsel before we provide the service, any service.
An important note to take from that, importantly, is that you can, as soon as you find out that you are pregnant, get to a facility and have an assessment done to see how far along you are with your pregnancy, and then your options can be discussed with you. Thank you so much, Mamthembi Zulu, the Acting Director of Women's Sexual and Reproductive Health from the National Department of Health. After the break, we'll speak to Dr. Tsiamo Nakanyane, an obstetrician and gynecologist, about the health risks of teenage pregnancy. Stay with us. Welcome back to Vital Signs. Now, most teenage girls don't plan to get pregnant, but many do. Teenage pregnancies carry extra health risks to both the mother as well as the baby. And often teens don't get antenatal care soon enough, which can lead to problems later on. They have a higher risk of pregnancy-related high blood pressure, as well as other complications, such as risks to the baby that include prematurity, as well as low birth weight. To help us understand these health risks and, of course, teenage pregnancy as a whole, we're joined by obstetrician and gynecologist Dr. Tsiamo Nakanyane. Doc, thank you for joining us again.
Sure.
Good. So can a teenager, and should teenagers be getting pregnant?
Well, they shouldn't, actually. Starting from what the law states about, the sexual act of a teenage person. There's the elements of, obviously, statutory rape there, and we do know that in our country, a lot of the teenage pregnancies are caused by people who are 2 years older than the potential mother or teenage mother. But the other thing from a health perspective is the things that you've just mentioned now, which include the risks associated with teenage pregnancy. So we generally associate teen pregnancy as a high-risk pregnancy because of the complications that we know that come with a pregnancy, including, as you mentioned, the hypertension or high blood pressures in pregnancy and complications that follow there. And also, the complications to the unborn baby, complications at delivery also, because there's a higher risk of cesarean section delivery, higher risk of operative deliveries and stuff. So because of all that, and also obviously when you look at the social impact of teenage pregnancy, that is definitely something that we should be trying to move away from or trying to prevent. But I mean, there are interventions out there. It's just that the reception of those interventions is quite difficult.
What do these interventions include?
I mean, access to contraception, sexual education, and actually trying to prevent these teenage pregnancies, all of those things. I mean, obviously, the whole access thing is also multifaceted because it comes from a point of the basic education of the involved patient or potential patient, the healthcare providers also, because there's been issues obviously of access, and a teenager gets to a clinic, requests contraceptives at 14 years, and they get a hammering as to why do you need contraceptives at 14. So that does become a bit of a challenge. It poses a challenge in the whole structure. But I mean, if everything could flow well, then the number of teenage pregnancies could potentially go low.
We've got Dikeletse on the line. Dikeletse, hello.
Hello.
Hi, how are you, ma'am?
I'm good, and you, sir?
Good. What's your question today?
My question is, I have a 16-year-old daughter. This year we went to the clinics for prevention. We used the implant, the one that they put it on the hand. It was on February. I just find out now that she is a month pregnant. Is it possible? If it's possible, what causes it?
Okay. Thank you so much for your question. We'll ask the doc, okay? All right. So this issue of contraceptive failure, where a lot of people have spoken to this idea where they go to the clinic, they have their pills, they keep taking their pills, and they find out that they're pregnant, and many other issues like that. But this one specifically is the implant that they would have had to put in. Do you find that you get a lot of contraceptive failure?
Look, all contraceptives, even sterilizations, have a risk of failure. There is a percentage of failure with all of them. The implant actually is one of the best in terms of the lowest failure rate. Its failure rate is even less than that of sterilization. So quite unfortunately, it happened in this instance that it did fail. There are a number of reasons why they could fail. But the other thing, one of the things to consider is, was she pregnant at the time it was inserted? Because that's a potential.
I think she said they put the implant in February and she's a month pregnant now.
Oh, she's a month pregnant now. Okay. It happens. It does happen, but this is just one in a large number of cases. So it doesn't happen often, but once in a while you will see a failing pregnancy. I mean, a failing contraception. At this point, obviously, she and her daughter can talk about the implication of this, whether they do want to keep the baby or whether they would like to terminate. So they can try and find out if they do want to terminate the pregnancy, find out how to follow the steps. Yeah.
Now, this brings about an important discussion to have, this idea of how the person has fallen pregnant. I think we live in a society where we're rape capital of the world, where, you know, there are large socioeconomic differences between people, so advantaged or disadvantaged children could find themselves being prey to older men that may want to, you know, take advantage of them. There's this idea of blesser and blessee culture and things such as that do play their part. Do any of these have an effect on why we have such a large number of children falling pregnant? Or is it a failure of education or a failure of contraception? What would you pinpoint it to be, if you think?
Look, we can't pinpoint it. It's basically all of those things that you've mentioned, if we're telling the truth. Because if you think about it, as you've mentioned, the whole blesser-blessee thing, it is rife in our country, especially in the poorer socioeconomic populations. We'll find that in those populations also there's a higher pregnancy or teenage pregnancy rate, and generally the fathers of those babies or unborn babies, or whether they're born or not, but though they then do not get involved in the pregnancy also. So it also creates a cycle of poverty or entrapment into the cycle of poverty. So to answer your question again, there's no pinpointing one thing. It's this and this and that. In terms of contraceptives also, specifically access is one of the bigger challenges. I mean, the contraceptives that are readily available will be your contraceptive pills, your 2-month and 3-month injections. But those ones also, access to them, you need to keep going back to your clinic. So your longer-acting contraceptives would play a bigger role, would help a lot more in terms of prevention of contraceptives. The other thing to consider is the dual contraceptives, where you're using any other form of these contraceptives that I mentioned, and on top of that, still use the condom. Yeah.
Now, to teenagers, a lot of the time, falling pregnant is one of those things where the education, for instance, might not have happened at home. You get to school and the education is somewhat there, but maybe the teacher's uncomfortable having those discussions, and you yourself find yourself chatting amongst friends about what sex might be, and you find teenagers falling pregnant by virtue of not being on contraceptives, but also experimenting as young people would do. Are there points of focus that we need to laser in on to make sure that the education of young people allows them not to fall prey to being pregnant?
Look, this one would definitely need to start from home. The home education, the openness of the child-to-parent relationship is very important, especially when discussing these sensitive issues. One of the things would be to aim to delay the sexual debut of any teenager. Okay. So instead of starting sex at the age of 12, 14, you know, try and keep them as best as you can. Obviously, it's not a thing that you just wave a wand and then you make it happen. It takes some form of strategy and work between the parents and the children. But try and delay it as best as possible. And when it starts happening, at least let them have some form of access to contraceptives. Let them know what they're putting themselves into. Let them know the risks that are associated there. Yeah.
Now, this idea of antenatal care is an important one, because we get to identify all the problems that may exist, any risk factors that the child may have, and of course, we prevent ourselves finding ourselves in a situation where you've got this 9-month-old pregnant 15-year-old girl showing up at a hospital ready to deliver a child. What does antenatal care look like for a pregnant teenager?
Look, it doesn't differ much from that of an adult pregnant person. The only thing is, obviously, we need to set it out, and the delivery also needs to be set out in a space where there's expertise, so in a secondary level hospital and stuff like that. Reasons being, obviously, in terms of delivery, the high risk of C-section and operative delivery. But in terms of the antenatal care itself, the antenatal visits still remain the same, but we do we stay cognizant of the things that need to be checked. We check if the baby is growing well. We check if there's no development of hypertension in this pregnancy and things like that. So it is very important for once they're pregnant and they're keeping the baby, whatever reasons be, it is important that they actually start antenatal care.
Now, you've mentioned that once they're pregnant and they've made the decision to keep the baby, then that will then have, you know, the level of the hospital and you'd get more A&C done. What options are available for those that, for instance, are pregnant and now don't know what to do? So we know that one path is keeping the baby and delivering the child. What other options do we have?
Look, the law allows any pregnant female to go into a termination, into a facility that offers termination of pregnancy and request termination of pregnancy if they are pregnant below a gestational age of 13 weeks, so 12 weeks, 6 days and less. They can request without any question and receive treatment and termination. Beyond that, up until 20 weeks, there needs to be some other reason, including social reasons, and also health risk to the mother and to the baby. But the other thing, and then beyond that, beyond 20 weeks, it will need to be, what's this? It will need to be a matter of health and life and death, obviously. But if they do want to, if they do want to terminate, it's better they go sooner than later. So sitting around and waiting and trying to decide what needs to happen and stuff, it makes it difficult. Obviously, because if you come to a health facility at 22 weeks and you just want to terminate, there's no particular reason, it becomes difficult for us as healthcare providers to offer you the option of termination. And in that instance, then we start advising in terms of, you know, complete the pregnancy and give the baby up for adoption or other options like that.
Lastly, the mental health on a young mother. These teenagers that fall pregnant where support isn't necessarily there because they're not telling anyone they're pregnant, they're not telling their parents, and then at 7 months they deliver these babies. What kind of mental health assaults happen to these young girls?
Look, it's a plethora of things, because we start with now, obviously, the stigma of falling pregnant at a young age. There's the whatever treatment they get during labor and delivery. I mean, obviously, sometimes they do get good treatment, but sometimes they find themselves being, you know, shouted at and stuff like that for many reasons. And then there's now this young, small baby that you need to take care of. So these children are actually at a higher risk compared to the general population of, you know, postpartum depression and things like that. And also there's everything else that follows with the stigmatization and all of that.
Well, Doc, thank you so much for joining us today. I think it was very important to discuss the physiology as well as the mental issues that go around being pregnant as a young mother. But importantly, if you do find out that you are pregnant and you are a teenager or a young woman, it's important to start your antenatal care as soon as you can to prevent any complications to you or the baby, or what decision that you may make from the moment that you find out that you are pregnant. Thank you to all the guests for joining us today and participating. And thank you to you, the viewer, for watching our show, Vital Signs. From me, Dr. Mosamtombeni, do take care.